On the line with us, Dr. John Gartner. He is a psychologist and therapist, former assistant professor of psychiatry at Johns Hopkins Medical School, the author of 2 books, contributing writer to the new book, The Dangerous Case of Donald Trump. 27 psychiatrists and mental health experts assess a president. His previous book, The Hypomanic Edge, the link between a little craziness and a lot of success in America. His website, John Gartner, GARTNER.com. And you can tweet him at John D. Gartner. Dr. Gartner, welcome to the program.
Yes, well, thank you for having me.
It's great having you with us. You, on the record, have been speaking about Donald Trump's presidency. This piece that Chauncey DeVega wrote in Salon, Trump's presidency may represent the greatest psychiatric disaster in history. Tell us about this.
Well, we have a situation right now where the most powerful man in the world, who can actually, at will, you were talking about extinction events before I came on as I was listening. This one human being has the power to make all of human life extinct. Take a minute to let that sink in. Right. And then consider that this person is grossly psychologically disabled. You know, we've been criticized for diagnosing him from afar, but at this point, the people who work with him closely every day, who are the opposite of afar, they are the ones who have the most intimate contact with him. According to this most recent book, but also other reporting, 100% of them, every single person around him, is concerned that he is psychologically unfit and that he is deteriorating, and that he seems to have the impulse control, judgment, and attention span of a child. Yeah. There seems to be clear evidence of organic deterioration on top of his severe personality disorder, the decrease in his vocabulary, in his capacity for logical thought, even his ability to form a sentence, much less think in sophisticated terms, is not recognizing people that he knows, is having difficulty with motor coordination when trying to drink water, or is slurring his speech. All of these are signs of pre-dementia. So we have someone who, before he became semi-demented or started on the road to dementia, had a malignantly narcissistic personality disorder, something that combines narcissism with paranoia, antisocial personality disorder, and sadism, so that he was already a maniacal dictator who was divorced from reality. Now he's also losing his cognitive faculties, so that this is someone who is very capable of impulsively and erratically and with poor judgment launching the nuclear codes. And the law is such that he doesn't need anyone to agree with him. He doesn't need a second key. There's no second key. And so we actually are in the position of having a demented madman having the keys to the nuclear codes. Yeah. If that's not frightening, then you're not paying attention.
I agree. The media deals with this by always going back to the Goldwater rule, which, you know, from either the American Psychiatric or Psychological Association, suggesting that mental health professionals should not comment on people that they haven't studied. My experience has been that if you are working with a person in a therapeutic context one-on-one, probably half of the work that you have to do in the first 3 or 4 or 5, sometimes 8 or 10 sessions, is getting past the BS of people telling you what they think what they want you to know about them, what they want you to hear about them, which is very often not only not true, but in some cases just leads you down complete rabbit holes. You know, so. You know, I would say meeting with people face to face, person to person, is vastly overrated. In fact, if you look at some of the, you know, high-profile figures who have been exhaustively biographied, you know, whether it's Thomas Jefferson or whether it's Richard Nixon, you talk to 30, 40, 50 people who work with them day in, day out, who lived with them, who knew them, you're going to get actually a much more accurate picture of their mental state than if you ask them yourselves. Or am I completely off base on this?
Well, guess what? There are hundreds of studies to show that you are dead on, that the psychiatric interview is the least valid method of diagnosis for exactly the reason that you described. And in 1980, we adopted the DSM, which is based on observable behaviors. All diagnostic criteria are based on observable behaviors. Before then, they were based on psychoanalytic theory. And so we actually have about 1,000 times more information on Donald Trump than I have on most of my patients. I don't follow my patients around all day and observe their behavior directly or observe it on TV. I don't troll their social media. I have the misfortune of having to write a book about his tweets, so I have to read thousands of his tweets. And in psychiatry, we often do interview in what we call informants, people who work with the patient or live with them, who do directly observe their behavior. And quite often informant data is more valid than the data we get from the patient. Well, this Michael Wolff book would be an example of informant data. These are people who live and work with the president every day, and these are the things that they're saying. Right. And what they are saying is that they are alarmed. They see him as psychologically unfit. They see him as being like a child. And that every single day in that White House, the issue of have we reached the 25th Amendment criteria yet is a topic of discussion. So, you know, forget the Goldwater rule. At this point, you don't need the Goldwater rule. This is so grossly apparent. It's so he's so grossly disabled that everyone can see it. It's like the emperor has no clothes. Only now, in this situation, if a young child said he's naked, he'd be screamed at and told it was fake news.
At least on Fox News. Yeah, at least on Fox News. An old friend of mine, he passed away a few years back, but his name is Armin Lehman, and he was, at the age of 15, he was the person who delivered to Adolf Hitler the news in the bunker that the war was lost, and he stood outside the door and listened to Hitler commit suicide. It was he wrote a book about it. It's called Hitler's Last Courier. Armin pointed out to me that Hitler was a megalomaniac to begin with, but that he really went crazy in the last year of the war, to the best of Armin's knowledge, when he became addicted to amphetamines and what's the drug you use to quit using heroin? I'm forgetting the name of it, but it's a narcotic. Methadone.
Suboxone or?
No, it was methadone. Hitler was addicted to methadone and methamphetamine, apparently. And Armin said his hands were trembling in the last days, and he couldn't hold a thought for more than 10 or 12 seconds. And so we've seen where a leader of a very, very powerful military nation starts out mentally unstable, but then is pushed over the edge by the use of drugs. Is there any analogy between that? I realize Hitler analogies are problematic, and we only have 40 seconds here left. But is there any analogy between that and the impact of dementia on somebody who's already mentally ill?
Well, absolutely. Dementia makes whatever your personality style or disorder is, it becomes 10 times worse as you enter the pre-dementia phase. So if you were irritable and paranoid and impulsive, you'll be 10 times more irritable and paranoid and impulsive. As your frontal lobes are deteriorating, your judgment, your impulse control, your ability to plan, your ability to sequentially even follow a thought begins to deteriorate. And by the way, the Hitler analogy is not misplaced, because the diagnosis of malignant narcissism was developed by Erich Fromm, who fled the Nazis, to explain Hitler and to explain Stalin and other such malignant dictators. And they all have a tendency to become more crazy and more detached from reality, more grandiose and more paranoid when they gain power.
Wow.
So gaining power actually causes them to deteriorate. So everyone was hoping he would pivot and become more presidential once he gained power, but we were trying to warn that psychiatrically speaking, it was much more probable that we would move in the opposite direction.
Amazing. Dr. John Gartner, hang on just